Robert was 72 years old, standing in his kitchen making a sandwich when his left hand stopped working. Just stopped. The knife clattered to the counter. He tried to pick it up again, and his hand would not respond. His arm felt heavy, like it belonged to someone else. And then his face started drooping on the left side. Robert knew exactly what was happening. He was having a stroke. He was alone. His wife was at her book club. His phone was across the room on the charger. And in that moment, Robert did something that neurologists say saved his brain. Something so simple that it sounds almost too easy to matter, but it does matter. And what he did in those 3 minutes before his wife came home and called 911 is the difference between Robert walking out of the hospital 5 days later and Robert spending the rest of his life in a wheelchair. I am Dr. Berg. I have spent years studying the physiological responses that occur during critical medical events, including stroke, and how the body responds in those first terrifying minutes before professional help arrives. I have reviewed what happens when people do the right things immediately and what happens when they do not. And today I'm going to teach you the exact 3-minute technique that can limit stroke damage before the ambulance even arrives. Because every second matters in a stroke. Brain cells are dying, thousands of them, every minute. And what you do in those first critical minutes can determine whether you recover fully or lose function permanently. But before I tell you what Robert did, you need to understand what is actually happening inside your brain during a stroke. Because once you understand the mechanics, the technique will make complete sense. A stroke is a blocked artery in your brain, usually a blood clot. It lodges in one of the vessels supplying oxygen to your brain tissue. And the moment that vessel is blocked, the brain cells downstream from that blockage stop receiving oxygen. And without oxygen, brain cells start dying within minutes, not hours, minutes. Here is the terrifying math. In a typical stroke, nearly 2 million brain cells die every single minute the blockage remains. 2 million per minute. After just 3 minutes, you have lost 6 million neurons. After 10 minutes, 20 million. These cells control movement, speech, memory, and sensation. And once they are dead, they do not regenerate. The damage is permanent. But here is what most people never learn. During a stroke, there are 2 distinct zones of damage. There is the core, where blood flow is completely cut off and cells die immediately. And then there is the penumbra, the surrounding area where blood flow is reduced, but not completely stopped. Cells in the penumbra are struggling. They are oxygen starved. They are on the edge of death, but they are not dead yet. And this is precisely where the 3-minute technique becomes critical. Because if you can increase blood flow to that penumbra, even slightly, even temporarily, you can keep those struggling cells alive long enough for medical help to arrive. You can shrink the total damage. You can mean the difference between losing your ability to speak and keeping it, between paralysis and recovery. Now you are probably wondering what Robert did standing in that kitchen with a useless arm and a drooping face, and I am going to tell you. But first you need to know the one thing most people do wrong that makes stroke damage significantly worse. When most people realize they are having a stroke, panic sets in immediately. Heart rate skyrockets, breathing becomes rapid and shallow, blood pressure spikes from the stress response. And ironically, this panic response makes the stroke worse. Here is why. When you panic, your body enters fight or flight mode. Blood gets redirected away from your brain and toward your muscles. Your blood pressure becomes erratic. The oxygen that is reaching your brain gets consumed faster because your heart and lungs are working at maximum capacity. You are literally starving your brain of the oxygen it desperately needs during the most critical minutes of your life. And there is something else. Many stroke patients in their panic attempt to get up and move, they try to get to the phone, to the door, to find help. And the physical exertion drains oxygen even faster. I have reviewed cases of patients who tried to walk to a neighbor's house during a stroke and collapsed halfway there. The exertion accelerated the neurological damage dramatically. So the first part of the technique is counterintuitive. You need to calm down. Not because staying calm will magically fix the stroke, but because panic makes everything measurably worse. And there is a specific way to force your body into a calmer state, even when your brain is telling you that you are dying. But calming down is only step one. There is something else you need to do with your body position that most people never consider. And this is exactly what Robert did that saved him. Robert felt his arm go limp and his face start drooping. And instead of panicking, instead of trying to get to his phone across the room, he did 3 specific things in order. And I am going to walk you through exactly what he did and precisely why it works. Step 1. He sat down immediately, not in a regular chair, on the floor. He lowered himself to the kitchen floor as controlled as he could manage and sat with his back against the cabinet. Why? Because sitting or lying down immediately stops the physical exertion that is draining oxygen from your brain. Your brain no longer has to compete with your leg muscles for blood flow. And critically, lowering your head closer to the level of your heart makes it significantly easier for blood to reach your brain against gravity. When you are standing during a stroke, your heart has to pump blood upward to your brain. That is demanding work, especially when blood pressure is already unstable from the stroke itself. But when you are sitting or lying down, the heart does not have to fight gravity as forcefully. Blood flow to the brain improves, not dramatically, but even a small improvement matters when brain cells are dying by the millions every minute. Robert sat down. That was step 1. Step 2. He controlled his breathing. This is the part that sounds too simple to matter, but the science behind it is completely solid. Robert began breathing slowly and deeply, in through his nose for 4 counts, hold for 2, out through his mouth for 6 counts. Slow, deliberate, controlled breathing. Here is why this matters physiologically. When you are having a stroke, your instinct is to hyperventilate, rapid, shallow breathing. But hyperventilation actually reduces blood flow to your brain. When you breathe too fast, you exhale too much carbon dioxide. Your blood vessels constrict in direct response. Less blood reaches your brain. You are making the oxygen shortage measurably worse. But slow, deep breathing does the opposite. It keeps carbon dioxide at normal levels. Blood vessels remain dilated. Blood flow to the brain is optimized. And critically, slow, controlled breathing activates your parasympathetic nervous system, the system responsible for calming your body. Heart rate stabilizes, blood pressure moderates, your body stops consuming oxygen in a state of panic. Robert sat on the floor breathing slowly for 2 minutes, just breathing, and while he did that, his brain was receiving slightly more oxygen than it would have if he had been standing and hyperventilating. Those struggling brain cells in the penumbra were staying alive longer, but he did one more thing. And this is the step that neurologists specifically recommend, but that almost nobody knows about. Step 3. He turned his head toward the affected side. Robert's left side was weak, so he gently turned his head to the left and tilted it slightly downward. Why would he do that? Because blood flow to your brain is not perfectly symmetrical. When you turn your head to one side, the carotid artery on that side opens slightly. The vertebral arteries which run upward through your neck can also be influenced by head position. By turning his head toward the affected side, Robert was attempting to maximize blood flow to the precise area of his brain that was being damaged by the stroke. Is this a cure? No. Is this going to reverse the stroke? Absolutely not. But is it going to potentially preserve thousands of additional brain cells by optimizing blood flow during those critical minutes before help arrives? Yes. And those preserved cells might be the difference between needing months of speech therapy and speaking normally, between a wheelchair and walking. Robert sat on the kitchen floor, breathing slowly, with his head turned to the left for 3 minutes until his wife came home and found him. She called 911. The paramedics arrived within 8 minutes. Robert received clot-busting medication within the critical treatment window, and he walked out of the hospital 5 days later with minimal deficits. Would he have recovered anyway? Perhaps. But the physiology is clear. What he did gave him meaningfully better odds. And when brain cells are dying by the millions, better odds matter enormously. Now let me tell you what else you must do the moment you realize you are having a stroke. If you are alone, you need to get to a phone. But here is the critical detail. Do not stand up and walk across the room. If you have to move, crawl. Stay low. Minimize every ounce of exertion. Every step you take standing upright is oxygen your brain is not receiving. If you can reach a phone from where you are, do it from there. If you cannot and you must move, crawl to it while maintaining as much calm as possible. And when you call 911, say 4 specific words immediately. I am having a stroke. Not, I think something might be wrong. Not, my arm feels strange. Say clearly and directly, I am having a stroke. These 4 words trigger the highest priority emergency response. The dispatcher immediately understands this is a time-critical neurological emergency. They will get an ambulance to you faster than if your symptoms are described vaguely. Then give your address. If speech is difficult because of the stroke, stay on the line. Emergency dispatchers can trace the call location. But getting those words out, I am having a stroke, and your address, those are the 2 most critical pieces of information in the first moments of this emergency. And if you are with someone who is having a stroke, do not allow them to talk you out of calling 911. I have reviewed cases where patients knew they were having a stroke, but did not want to cause concern. They waited. They hoped it would resolve on its own. And by the time they arrived at the hospital, the window for clot-busting medication had permanently closed. The damage was irreversible. A stroke is a medical emergency, not a wait-and-see situation. Call immediately without hesitation. Let me explain the treatment window, because understanding this makes absolutely clear why every single minute matters. When you arrive at the hospital during a stroke, you go directly to a CT scan. Physicians need to visualize your brain immediately to determine the type of stroke occurring. Is it ischemic, caused by a blocked vessel, or hemorrhagic, caused by bleeding in the brain? The treatment approach is completely different for each type. If it is ischemic, which accounts for approximately 87% of all strokes, and you are within the treatment window, you receive a medication called TPA, tissue plasminogen activator. This medication can dissolve the clot blocking your brain's blood supply. It is extraordinarily effective when administered in time. But here is the critical limitation. It must be given within 4.5 hours of stroke onset, preferably within 3 hours. After that window closes, the medication becomes too dangerous because the risk of bleeding in the brain outweighs the potential benefits. And even within that window, sooner is always better. Data from the American Stroke Association shows that for every 15-minute delay in treatment, stroke patients lose an average of 1 month of disability-free life. 15 minutes equals 1 month of functional life. That is how precisely time-critical this emergency is. So when you perform the 3-minute technique, sitting down, controlled breathing, optimal head positioning, you are not just preserving brain cells. You are keeping yourself stable enough to remain conscious, to communicate with emergency services, to give paramedics accurate information when they arrive. You are buying critical time for the treatment that can reverse stroke damage. There is something important you need to understand about strokes that specifically affects people over 60. Your risk of stroke doubles every decade after age 55. By the time you reach 75, your stroke risk is 8 times higher than it was at 50. Why? Because the blood vessels in your brain age alongside the rest of your body. They become stiffer and less flexible. Plaque accumulates on vessel walls, gradually narrowing them. Blood pressure tends to increase with age, placing additional stress on these aging vessels. And conditions like atrial fibrillation, an irregular heartbeat that generates blood clots, become substantially more common after 60. If you have high blood pressure, atrial fibrillation, diabetes, or if you smoke, your risk is elevated significantly beyond the baseline. And here is what concerns me most about these risk factors. Many strokes are genuinely preventable. Blood pressure medication works. Blood thinners prescribed for atrial fibrillation work. Controlling blood sugar works. But people do not take their medications consistently. They skip doses. They discontinue treatment because they feel perfectly well. Feeling well does not mean you are physiologically safe. High blood pressure causes no pain. Atrial fibrillation frequently produces no symptoms whatsoever. Diabetes can remain clinically silent for years. You feel completely fine right up until the moment the stroke occurs, and then fine is simply over. If your physician prescribed blood pressure medication, take it every single day. If you are on a blood thinner, take it exactly as directed. These medications are preventing the stroke you have. No awareness is coming. A daily pill taken consistently for 30 years is infinitely preferable to a single day, unable to speak or move. Let me describe what happens in the minutes and hours after you arrive at the hospital, because understanding this sequence demonstrates clearly why the 3-minute technique matters so profoundly. If the CT scan confirms an ischemic stroke and you are within the treatment window, TPA goes into your IV. Within minutes, it begins dissolving the clot. Blood flow is restored to the affected area. Brain cells that were starving for oxygen begin recovering, but not all of them. The cells that died in the core zone are permanently gone. However, the cells in the penumbra, those struggling cells that were on the edge, many of those can recover if blood flow is restored quickly enough. This is precisely why what you did in those first minutes matters so critically. The more penumbra cells you preserved with the 3-minute technique, the better your potential recovery. After TPA administration, you are monitored carefully because the medication that dissolves clots can also cause bleeding if the situation is not managed precisely. But when it works, and it works most of the time when administered early, the results can be genuinely remarkable. Some patients who arrive unable to move their arm leave the hospital 1 week later with full function restored. Not every patient. Stroke recovery varies considerably based on multiple factors, but early treatment gives you the best possible chance at the best possible outcome. Now let me address something important. What if you wake up with stroke symptoms and you do not know when the stroke actually began? Approximately 25% of strokes occur during sleep. You go to bed feeling completely well and wake up with weakness, slurred speech, or facial drooping. These are called wake-up strokes, and they present a clinical problem because the time of onset is unknown. You may potentially be outside the treatment window, but there is important news here. Advanced MRI imaging technology can sometimes determine whether brain tissue remains salvageable even without knowing the precise time the stroke began. Some wake-up stroke patients remain eligible for clot-busting treatment based on these sophisticated imaging findings alone. So even if you wake up with stroke symptoms and have no idea when they started, call 911 immediately. Do not assume the treatment window has passed. Let the hospital make that clinical determination with proper imaging. And while you wait for help, use the 3-minute technique. Lie down, control your breathing, position your head toward the affected side. Give your brain every possible physiological advantage you can provide. I want to discuss something critically important that is difficult to hear clearly, but that could genuinely save your life. What are the warning signs that a stroke may be approaching? Some strokes occur entirely without warning, but many, perhaps most, provide warning signs in the hours or days before the main event. These are called transient ischemic attacks, TIAs, sometimes called mini-strokes. The symptoms are identical to a full stroke: weakness, facial drooping, speech difficulty, vision problems. But they resolve within minutes to hours on their own. A TIA is your brain's emergency alarm system. It is telling you clearly that blood flow to part of your brain was temporarily blocked. The blockage cleared spontaneously this time, but it is a critical warning that a full stroke may be imminent. Statistics demonstrate that after a TIA, your risk of experiencing a major stroke within 90 days is approximately 17%, nearly 1 in 5. If you have stroke-like symptoms that resolve on their own, you do not feel relieved and ignore them. You call 911 or go directly to an emergency room immediately. A TIA is a medical emergency requiring urgent evaluation. Treatment following a TIA can prevent the major stroke that the data suggests is coming. And here is what makes this outcome so tragic when it occurs. I have reviewed cases of stroke patients who described warning symptoms days before their major event. Their arm went numb for 10 minutes and then returned to normal. They experienced brief slurred speech that resolved completely. They did nothing because the symptoms disappeared, and then the full stroke arrived, and this time it did not resolve. Do not be that person. Know the warning signs: face drooping, arm weakness, speech difficulty, vision changes, sudden severe headache unlike any previous headache, dizziness, and loss of balance. If you experience any of these, particularly if you are over 60, seek medical attention immediately. even if every symptom has completely resolved by the time you consider calling. Let me be completely direct about something. The 3-minute technique is not a treatment for stroke. It is a method of preserving brain tissue and maintaining physiological stability while you wait for real medical intervention. You still need 911. You still need the hospital. You still need clot-busting medication or whatever intervention the treating physicians determine is appropriate for your specific situation. But in those critical minutes before the ambulance arrives, you have genuine, meaningful control. You can sit down, you can control your breathing, you can position yourself to optimize blood flow. These simple actions can preserve brain function that would otherwise be permanently lost. Here is what I want you to do right now as you watch this. Think carefully about where you spend most of your time. Your kitchen, your living room, your bedroom. Where is the nearest place you could safely and quickly sit or lie down if stroke symptoms suddenly appeared? Where is your phone? Can you reach it from that position without standing and walking? If you live alone, keep your phone on your person, in your pocket, not charging across the room. Because if you cannot reach the phone in the first minute of a stroke, the 3-minute technique becomes irrelevant. The ability to call for help is the foundation everything else rests on. Talk to your family. Make sure the people who live with you or spend significant time with you know the stroke warning signs. Make sure they understand to call 911 immediately, not to wait and observe whether symptoms improve. Make sure they understand not to allow you to talk them out of seeking help if you insist you are fine. I have reviewed too many cases where a partner had unmistakable stroke symptoms and the other person waited because the patient insisted they were fine, because they did not want to overreact, because they were embarrassed. By the time they arrived at the hospital, the treatment window had permanently closed. Do not allow pride or concern about overreacting to prevent life-saving intervention. If you have risk factors, high blood pressure, atrial fibrillation, diabetes, take them seriously every single day. Take your medications consistently. See your physician regularly. Have your blood pressure checked. These routine, unremarkable daily actions are what prevent the catastrophic emergency that changes everything. Robert, the man whose story opened this video, takes his blood pressure medication every single day now. He did not before the stroke. He felt completely fine and believed he did not need it. Now he understands what that assumption nearly cost him. And he is fortunate to have received a second opportunity to learn that lesson. Not everyone receives that second opportunity. Approximately 1 in 6 stroke patients dies. Many more are left with permanent disabilities. Some cannot speak, some cannot walk, some cannot care for themselves. And for many of them, the outcome could have been genuinely different if they had acted faster, if they had known what to do in those first critical minutes when everything was still potentially salvageable. You now know what to do. Sit down immediately, control your breathing, position your head toward the affected side, get help as fast as humanly possible. These are not complicated steps. They do not require training or equipment or medications. They require only the knowledge you now have and in the presence of mind to use it. I am Dr. Eric Berg. Share this with someone you care about who is over 60, because you genuinely never know whose life this information will protect until the moment it does. And I will see you in the next video.